Good evening, everyone. I would like to call the business meeting of the Portland Board of Public Education to order. It is Tuesday, August 3rd, 2021, and we are meeting in person.
Oh, yeah.
Welcome. May I please ask the superintendent to call the roll?
Yes, Madam Chair. Ms. Bondo.
Présente.
Mr. Burke.
Here.
Mr. Irish. Mr. Rodriguez.
Presente.
Ms. Russell-Vetter.
Here.
Ms. Thompson. Ms. Trevorrow. Mr. Youssef.
Here.
Ms. Allen. Ms. Boxer-McCumber. Ms. Chung.
Here.
Ms. Hill. Ms. Yangala. And Chair Figdor.
Here. And Ms. Thompson wanted everyone to know that she is ill tonight and apologizes for missing the meeting. And Ms. Trevorrow and Mr. Irish also, as you heard, are unable to join us. Okay, with that, would everyone please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That was the best we've done in a year and a half.
Time, yes it is.
Congratulations. All right, so we are going to start off tonight's meeting as we now typically start all meetings with public comment. So the public comment period now is for issues that are not on, specifically issues that we're not voting on tonight. So if you would like to address the board, you can come up to the podium, state your name and address, and you have 3 minutes. So if anyone's interested in commenting and addressing the board, please go ahead now.
Going to the board?
Yeah. I think he's just putting a microphone there.
Hello. I hope you can hear me with my mask. I'm going to read this because I'm not a public speaker. My name is Allison Crocker. I am the mother of an incoming freshman at Portland High School. I'm not going to talk about the COVID policy tonight. I figured there would be a lot more other people here to discuss that, although it doesn't seem that to be the case. Coming here tonight was the last thing I really wanted to do. I always thought myself very involved in my daughter's education, but the pandemic opened my eyes to my own complacency. On May 1st, 2021, I sent a letter to Mr. Bottano and the board expressing concern with the shift away from core educational principles towards more activist and political content. My inquiry was polite and professional. However, to date, I have not received a response. While my concerns were genuine, I knew sending the letter was a futile act. I never really expected a response, as your disdain for dissenting opinion has been painfully clear. The roles of educator and parent should be clearly defined, with morals, values, and religion falling squarely under parental obligations and responsibilities. Instead, you are using the need for additional school services as an inroad to assume all parental responsibilities, seeking to supplant long-standing family values with radical, non-factual theories. Instead of meaningful engagement with the public, the comment section of your meetings is a mere formality. There's no interactions. Questions can be asked, but are only selectively addressed if you decide they support your agenda. I have watched in awe as you sit through emotional commentary, stone-faced or just plain disinterested. Some of you texting, others multitasking, or in the case of Mr. Rodriguez, dismissively mumbling into a hot mic. Once
Excuse me, Allison. Our policy is not to call out individual board members or staff.
In the case of one board member dismissively mumbling into a hot mic and then having it covered up by another board member during the meeting. So I apologize for breaking the rules there. Once the public comment section is complete, you're different people, animated with boundless enthusiasm and endless ramblings of your self-adoration. You carefully choose your words, speaking as if your agenda is a moral imperative, complete with the implication that dissent cannot and will not be tolerated. Led by Mr. Bottano, you seize any opportunity to advance your equity agenda while ignoring anything that does not fit your narrative. You endlessly opine on national events and shamelessly use them to sow the seeds of hatred and mistrust in our community. You unapologetically demonize vast segments of the population and urge others to do the same. Ironically, in the name of progress...
Allison, your time is up. Thank you so much for addressing the
Don't
board.
you get to say, do you have 3 more minutes? Isn't that the rule?
It is the board's prerogative.
I'll move to give her another minute.
A second.
All right, all
Thank
in
you.
favor?
Because that would just be like proving my point if you shut me down right now.
Excuse me, Allison. All in favor of giving Mr. Crocker 3 more minutes? Okay, you can go ahead.
In the name of progress, your assignments are shockingly partisan, often insinuating the United States is an evil nation, the police are a threat to public safety, and white people are inherently racist. You extol the virtues of external diversity while at the same time preaching uniformity of thought. You no longer teach students how to think critically, but what to think to avoid public scrutiny, shame, and criticism. Anticipating resistance to my questions, I enlisted the aid of No Left Turn in Education to help a nonprofit formed in 2020 to help fight radical indoctrination in our schools. Well, it would be preferable to keep the issues within our district. No Left Turn has endless resources and valuable insight onto restoring the parental function in public education. With their assistance, I plan to obtain the information I previously requested from you. But that request, of course, was ignored. I will be obtaining the documents on the teaching of critical race theory, the 1619 Project, Comprehensive Sexuality Education in the Portland schools. Additionally, with the recent revelation that information from the Abolitionist Teachers Network was erroneously cited in the NEA as eligible for purchase with COVID funding, I will be requesting those materials as well. Finally, until I see open and productive lines of communication between you and the entirety of the parental community, I or another local representative will continue to voice our concerns at our future biweekly meetings. Thank you.
Thank you, Allison. Is there any other member of the public who would like to address the board?
I just have a question. You're voting next meeting on the masks and things, correct?
On the school reopening policy, yes.
So today would be the day to talk about it.
Absolutely.
Great.
And I just want to clarify that there will be an opportunity next week as well, but it will be later in the meeting during the section of the meeting where we're considering that policy.
Yes.
So, but you're, by all means, can address the issue now.
And we are planning to have a public hearing on it as well, so there would be another opportunity at the beginning of the next meeting to address any concerns that you have at that time.
Great.
But go ahead, we want to hear from you now.
Thanks. Yeah, I was like, this works. I'm here. So my name is Stacey Hung. I am a pediatric nurse. I worked at Barbara Bush for several years. I'm a parent of 2 children, one of which I just pulled from public school and is now going to St. Bridget's for her 8th grade year, but the other one is at Portland High School, and then she will probably be attending Portland High School afterwards. So I do have some skin in the game as far as how I feel about my kids and going back into school. And as a pediatric nurse, it's just something that I've been thinking about. Where are we going with the mask thing and how we go with COVID? And so I did some really quick research on the way here. And if I'm talking about just Cumberland County, there are roughly 300,000 people in the city, in Cumberland County alone. And I looked at the amount of cases that have happened in Cumberland County. There's about 13,000 positive cases out of the 300,000 residents. That equals roughly 4% of the population in Cumberland County. We're not talking even just Portland, who have had COVID. Out of those 13,000, or out of all of the people who have had COVID in the state of Maine, there have been, or in roughly Cumberland County, sorry, I'm a little bit nervous talking out loud in front of everybody this morning, or this afternoon. There's 205 deaths. Not that any death is okay, but that means that there's only been 0.068% death of the people dying from this illness. What I've seen, because I am a school nurse and I work in a high school, is I'm having more issues with kids with mental health issues. They already struggle with their social media outlet. They don't know how to talk to people. They don't know how to make eye contact. They're spending a lot of their time doing this. And now we have covered their face. So now they don't necessarily even know how to make regular interactions and understand how to read a room and know how people are feeling about things. Our suicide rate in the state of Maine, there were 301 deaths last year just due to suicide. So that rate is higher than the death rate. Not that that's necessarily okay. It's just my plea to you is to really consider what the kids are dealing with. Out of all of the people who have died in the state of Maine, only one has been under the age of 20. And also as a school nurse who put plenty of kids in quarantine, it's just something to think about. Out of all of the kids I quarantined last year, none of them came down with COVID once I made them a close contact and put like 40 more kids at home for 10 more days. So these are just some things I would like you to maybe consider. I know that we are bound by the Department of Education and what they are going to put down for guidelines for us, but you also have the ability to either make them stricter or just follow what the state is offering for us. And I would just hope that you would consider the emotional well-being of our children and let them see faces, let them understand language, let them see how people are speaking to them, and know that they are still safe in that sense. Thank you.
Thank you so much, Stacey. Is there any other member of the public who would like to address the board tonight? Thanks so much. Please state your name and address, and you have 3 minutes to address the board.
My name is Amber Schhertz. I hope you can hear me okay. My address is 173 Christie Road.
It's a little hard to hear you.
My name is Amber Schhertz. My address is 173 Christie Road, Portland. I have 2 kids in a Portland elementary school. I really appreciate everything the school board has been doing to keep kids safe. I really appreciate everything the school has been doing. I know it's a lot on the teachers. I know it's a lot on the staff. So I want to convey how much I understand and appreciate that. I do want to ask that as we look at mask guidelines, that you let parents make those health decisions at this point. It has been long enough. Our kids are not all right. They are not handling school well. They are disengaging. They are losing their education because they don't care and they're angry. I have a 10-year-old who doesn't care about school and he's angry. And we are doing our best to give him perspective, and we are doing our best to encourage him. But what I'm asking is that you focus on the education of our kids. Make sure you follow minimum guidelines, but with the masking being optional for school districts across our state, I really would need to understand as a parent why it would be proposed that they be required for Portland schools. There's a lot of other topics that I'd be concerned about with the school and making sure that we're prioritizing education. But for right now, that is my biggest thing, because if we can't get over that hurdle, my kid's future is on the line, as well as many other anxious children. Thank you.
Thank you so much, Amber. Is there any other public comment tonight? Okay, I am going to go ahead and close the public comment period, and we will move to the report of the chair. And tonight my comments are very brief. I wanted to do 2 things. First, I wanted to thank the board. Typically during July, we take a pause from our work, which is very demanding. All of us have jobs and lives, and many of us have kids. And in July, we typically take a little break and get to catch our breath, enjoy the summer a little bit. This summer, I know we asked the board to do more work than is typical. We met twice during the summer, and I just want to acknowledge everyone's commitment and dedication and time, and thank you for doing this work day in and day out, and including during the period where we usually do have more time to catch our breath after what was, the most challenging year. So thank you to all of the board. And then second, I wanted to say, as we move into the conversation about school reopening and fully opening school in the fall, I want to acknowledge how heavy the topic is, how challenging it is, and the people are coming from different perspectives. But the important thing is that we manage to keep our students and staff and families safe throughout the entirety of the pandemic so far. And I'm very confident that as we continue to take the necessary precautions, that we will be able to keep our students and community safe moving forward. So I look forward to tonight's presentation and our conversation about how to both have kids in school full-time and do so safely starting next month. Actually, starting this month, as my kids keep reminding me. So that is it for my report. I'm going to now move to the report of the superintendent, Mr. Botana.
Thank you, Madam Chair. Portland Public Schools recognizes the original inhabitants of the land on which our city and schools stand. The Wolastoqiyik, Micmac, Penobscot, and Passamaquoddy tribes known collectively as the Wabanaki Confederacy, or People of the Dawnland. We are honored to have Wabanaki children among our students today, and as a district, we are committed to making the past, present, and future of Wabanaki peoples visible in our schools and classrooms. Welcome to the 2021 school year. I'm excited to start this new school year, my 6th as superintendent of this remarkable school district. Welcome back to in-person board meetings. I look forward to the in-person interactions with all of you and the public. Well, I also acknowledge the ease with which those interactions grew and were made possible by the use of technology this past year, and we'll be talking more about that later in the agenda. I would like to start by recognizing our Deering High School Athletic Director, Michael Daly. Michael obtained his Certified Athletic Administrator license from the National Interscholastic Administrators Association, and this puts Mr. Daly in an elite group of athletic directors nationally to achieve this level of professional knowledge and skills. Michael has been a welcome addition to the PPS family, and he has demonstrated his commitment to continued learning and developing his professional capacity through his engagement in this rigorous educational program. Thank you, Michael. And congratulations on this important professional achievement. Tonight, I want to update you on hazard pay for PPS staff. As you recall, last November, voters in Portland approved the minimum wage ordinance, which provided for the minimum wage to increase during a declared emergency. At the December 22nd, 2020 board meeting, the board decided to adopt a hazard pay requirement for staff working on site. This impacted approximately 100 employees who earned less than $18, including some staff in the base, ed tech, and non-represented categories such as custodians, cafeteria workers, bus assistants, ed techs, building aides, and other miscellaneous temporary support positions. The cost of implementing the increase was approximately $85,000 for the totality of the FY21 budget year. As you know, the state of Maine lifted the statewide state of emergency on June 30th, 2020, and the city of Portland lifted its state of emergency on July 19th. We all know that yesterday they reinstated a limited emergency for the purpose of public meetings. We continued to pay the emergency minimum wage through the end of the school year, and we also included the rate in our summer program's rate of pay. The emergency minimum wage rate of $18.23 an hour will be discontinued when our summer programs end, and it has been eliminated for all new hires who are currently being offered employment. We had set aside federal funds to continue these payments for the current year, but in light of the expiration of the emergency declaration, those funds will be available for other appropriate uses. As we look ahead to the start of the school year, I'm pleased to announce that we're collaborating with the Portland Education Association to infuse some team spirit, fun, and recognition into our return. Our staff is excited to be coming back to school full-time, 5 days a week, and in celebration, we will be hosting a back-to-school 5K for staff, and board members are invited as well. on August 23rd around the Back Cove, and an evening event at Thompson's Point on September 2nd for staff and their families. We're looking at other fun competitions and celebrations over the course of the fall and beyond, and I'm excited about the spirit of togetherness that these activities will help us to foster. I want to thank PA President Carrie Foster for her energy and commitment to get this off the ground after what was a hard year for all of us. This type of fresh and energetic start is just what we need. I also want to take the opportunity to say that we also want members of the public to participate by adding testimonial and well wishes in a virtual yearbook that we've started and that will soon be on the front of our webpage. A couple of weekends ago, the Foundation for Portland Public Schools was the beneficiary of the generosity of the Portland Kids Duathlon organizers. The foundation received a check for over $11,000, which is amazing. But what was most rewarding for me was to see hundreds of students and families enjoying healthy activities outside together and in person. I would like to thank Benchmark Realty and its partners for this ongoing, inspiring summer fundraiser for the foundation. And that concludes my report.
Can we ask a question?
Mr. Superintendent, Ms. Bondo has a question for you.
Yeah, thank you. Thank you, Madam Chair. I just need some clarification for my own understanding about ASAP pay. When we have the 100 employees, so we paying them until the end of the year with the $18.50 an hour, right? So after the end of the year, they're going back to the minimum wage. So what's going to happen as the next step after the end of the year?
So any future increases, and I just want to be clear, not at the end of the year.
Okay.
It will end.
The end of summer?
At the end of the summer,
Okay.
right? So we will not be continuing that into September and beyond. And for the people that fall below that rate, they'll go back to their currently negotiated rate of pay.
Okay.
And so any future increases would be a result of collective bargaining for those who are represented employees or, board decisions and those other situations.
So those employees, they're aware all the steps that we taking care. I mean, the ending until September, and everything's going to come after that. They're aware? They know what the next steps will be?
I am not sure what we've done in terms of notice. Ms. Stoddard, do you want to address that?
Good evening, everybody. Yes, we have sent out notifications. It's mainly the summer folks.
Okay.
The school year folks have really already ended their employment, and so we have some temporary employees this summer as well, and we've notified them.
So what you mean about the summer folks, I mean, we had a full year, so those are the cafeteria, those are the custodian. So those are specific employees working during summer, or those are employees been working since we have a returning of school?
Food service has very few staff that work year-round.
Right.
So they are employed in the summer as summer employees, separate from their school year assignments. Custodians, anyone who falls below the 1823, will be reverting back in the month of August.
Okay. Can we have some follow-up of what's going to happen for the next step, if you don't mind?
Sure.
So
Thank you.
I don't know, can you be more specific about what you mean by
No, I just want to
follow-up?
make some understanding
Yeah.
what the next step will be after September. So if they're going back to the previous wages they had before those hazard pay, that's what I just want to know. If also they're aware about those next steps, I mean, they should be prepared, because that's going to be a lot of hardship on the living expenses. I just need to make sure that we follow those protocols, but let them know in advance what's going to happen, so they are prepared about those next steps.
Yeah, we will absolutely notify them.
Okay.
In those cases where they haven't been notified, they will be notified.
All right, thank you.
Okay, terrific. Now we're moving to the report of the secretary. And for tonight, we're doing something that we typically don't have to do, which is we are approving minutes from 3 meetings. So I want everyone to bear with us through that process. But we are approving the minutes of our last full board meeting, as well as the 2 special board meetings that we held after the end of the school year. So first, we're going to move to consideration and action to approve the meeting minutes of June 15th, 2021. Is there a motion?
So moved.
Ms. Bondo, seconded by Mr. Rodriguez. Are there any questions on the motion? So specifically on the minutes from June 15th. Okay, is there any public comment on the motion? So is there any public comment on our meeting minutes from our June 15th meeting? Okay, don't see any public comment. I'm going to move to board discussion. Is there any board discussion on the minutes? All right, by roll call vote, please indicate whether you are in favor of approving the meeting minutes from our June 15th, 2021 meeting. Mr. Superintendent, will you please call the roll?
Yes, Ms. Chair. Ms. Bondo,
Yes.
Mr. Burke,
Yes.
Mr. Rodriguez,
Yes.
Ms. Russell Better,
Yes.
Mr. Youssef,
Yes.
Ms. Allen,
Yes.
Ms. Chung,
Yes.
and Chair Figdor.
Yes. So the motion passes unanimously and the minutes are approved. So now we're moving to consideration and action to approve the meeting minutes of the July 6, 2021 budget hearing, special business meeting, and workshop. Is there a motion?
So moved.
Ms. Russell Better, and is there a second?
Second.
Seconded by Mr. Rodriguez. Are there any questions on these meeting minutes from our July 6th meeting? Questions from the board? All right, I don't see any questions from the board. Is there any public comment on our meeting minutes from our July 6th meeting? Seeing no one approach the podium, I'm going to close public comment and move to board discussion. Is there any board discussion on the meeting minutes from our July 6th meeting? Okay, by roll call vote, please indicate whether you are in favor of consideration of approving the meeting minutes from our July 6, 2021 meeting. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo,
Yes.
Mr. Burke,
Abstain as I was not present.
Mr. Rodriguez,
Yes.
Ms. Russell Better,
Yes.
Mr. Youssef,
Yes.
Ms. Allen,
Yes.
Ms. Chung,
Yes.
and Chair Figdor.
Yes. So the meeting minutes from our July 6 meeting pass with 5 board members voting in the affirmative, 1 abstention, and the students joining the majority. Next, we are going to approve consideration and action to approve the meeting minutes of the July 20th, 2021 meeting, special business meeting. Is there a motion?
So moved.
Mr. Rodriguez, is there a
Second.
second? Ms. Bondo, are there any questions on the motion? This is our July 20th special business meeting. Seeing none, is there any public comment on the meeting minutes from our July 20th meeting? Seeing none, I'm going to close public comment. Is there any board discussion on those meeting minutes? Seeing none, by roll call vote, please indicate whether you are in support of approving the meeting minutes of from our July 20th, 2021 special business meeting. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo,
Yes.
Mr. Burke,
Abstain as I was not present.
Mr. Rodriguez,
Yes.
Ms. Russell Better,
Yes.
Mr. Youssef,
Abstain, I wasn't present.
Ms. Allen,
Yes.
Ms. Chung,
Yes.
and Chair Figdor.
Yes. So
We have a quorum of those present.
we have a quorum of those present. Excellent. So the motion passes with 4 board members voting in the affirmative, 2 abstentions, and the students voting with the majority. Terrific. Thank you for your patience in moving through those minutes. Now we're going to move to consent items. Mr. Superintendent, will you please speak to this item?
Yes, Madam Chair. Under Board Policy KCD, the school board accepts by unanimous consent contributions made to the school district. As required by that policy, all of the donations are listed in the board agenda under this item. Our practice is for each item to receive, for each donor to receive a written contribution acknowledgement expressing our heartfelt gratitude as well as for their tax purposes. I would like to thank the many generous contributors to the Portland Public Schools who have made donations of durable goods, goods of substantial value and historical or commemorative significance, including a Sonart accordion and a linen mounting board for artwork from Joy Granis, a clarinet valued at $125 from Bridget Wachowski, and $200 for the PHS Food Pantry from April and Dennis Noonan. We're very grateful to all three of them for their generous support and contributions to the work of the Portland Public Schools.
Excellent. Thank you so much. Now we're on to our board focus, and tonight it is on the school year 2021-2022 reopening plans and safety and health procedures. Mr. Superintendent, the floor is yours.
Move over to the podium.
Okay, excellent.
As we have a PowerPoint presentation. Okay. We also, I do want to let you know that we have Tina Bailiu, our head nurse, is here with us to answer any questions that you may have. And we're also joined by Dr. Gita Rao, who is our new school physician. As you know, Dr. Patterson, who was our longtime school physician, retired at the end of the year. And we're very, very fortunate to be able to expand our partnership with Greater Portland Health by being able to work directly with them. And Dr. Gita has been invaluable partner for the school district for a long time now, working in our school-based health clinics, and she now is also our official school physician. So thank you both for being here today, and we'll have them available as part of the questions. So tonight, I would like to update you on our plans for returning to school for the FY 21-22 school year. As we indicated back in the spring, our intent has been to return to full-time in-person instruction 5 days a week for all of our students this coming year. And I'm happy to report that that is, in fact, our plan today. I would also like to point out that I had hoped, as I know many of you had, that there would be less need for mitigation protocols than what we are going to discuss tonight. I think when the school year closed, we were on a sharp decline of cases in the community. Vaccinations were moving full speed ahead, and I know that at the deepest of my core, I was hoping that we would be able to return to school with minimal additional precautions. Unfortunately, we all know what has transpired since then, so tonight I want to walk through the mitigation plans and their rationale with you. Our goals for tonight are to present our recommendations and, basically answer any questions that you may have. Between tonight and August 17th, when we're hoping you will approve our plans, we will listen to your thoughts and concerns, as well as feedback from members of the Portland Public Schools community and any revised recommendations or insights from public health officials, and adjust our plans for your approval. The elementary and secondary emergency relief funding requires that we engage the public and obtain our governance approval for our return to school plans. So this process is designed to get meaningful feedback on our plans and to satisfy that planning requirement. As I mentioned earlier, when one of the speakers addressed us, that we will have a public hearing ahead of the meeting on the 17th, so that there is a formal opportunity for you to hear any additional feedback that we may not have heard by that time. As has been the case throughout the pandemic, we've adhered to those design principles that you see on the screen as we went about our planning for return to in-person instruction. The graphic is familiar to you by now. It centers meeting the needs of our most marginalized students and families in our plans and elevates key design features such as coherence and consistency and the ability to respond with agility to the evolving situations and circumstances. Next, I would like to talk about the current guidance from the Maine CDC and the Department of Education and the U.S. CDC guidance, which informs both the DOE's direction as well as the decisions that we've made in our plans. So I'm going to start with the CDC guidance, and as you can see from the slide, I think it's important to understand that the CDC's statements very strongly support the importance of in-person instruction for students, as that is the primary consideration, and that all other considerations should be seen in the context of, being able to meet that important goal of having all of our students in school in person for instruction. The CDC also positions vaccinations as the single most important management and mitigation strategy. So all of the other mitigation strategies that you see there are things that are supplemental to the absolutely most powerful one, which is the vaccination plans. It recognizes, of course, that for children who are 11 years and younger, that vaccinations are not currently available. So as an alternative, the CDC recommends that other layers of mitigation be used as an alternative. And so specifically, they call for masks being worn indoors by anyone who is not fully vaccinated, and especially indoor, of course, and in crowded settings, and particularly when physical distancing cannot be maintained. CDC also recommends that we maintain at least 3 feet of physical distance between students within classrooms, combined with indoor masking wearing by people who are not fully vaccinated. And then when it's not possible to maintain physical distance, which is the case for us, it's very important to be able to layer in all of the mitigation strategies that we're going to be talking about. So things like indoor masking, testing, of course, ventilation, hand washing, respiratory etiquette, and making sure that if people are sick, that they stay home, they don't come to school, and cleaning and disinfecting, as well as doing our contact tracing and quarantining and things along those lines. So that's where the CDC is, and that's the guidance which, as you know, was issued very recently about the importance of having masks being worn in schools, recommending that. The current DOE guidance is also very much aligned to the CDC guidance for our schools. It requires that masks be worn on public or private school transportation. Any transportation that we provide is required, so that includes our buses and our vans, where it will continue to be required for everyone to wear masks as a result of the federal guidance, which has been adopted by the state. The current DOE guidance promotes vaccination as an important element of limiting the spread of COVID, and also as a way to reducing the number of people who will be quarantined, because currently individuals who are vaccinated are exempt from quarantining. That could potentially change, but at this time that is a part of it. The state is promoting pooled testing for early detection of potential infection within the schools, and we will be talking more about that. And the state currently indicates that masks and distancing, when possible, are strongly recommended when inside for those who are unvaccinated, including staff and students. And so it's their recommendation that we do that in those particular cases. And it requires that there be adherence to the existing standard operating procedures for responding to COVID-19 cases in schools, which again, that has not been revised for a number of months now, but we understand that there is a revision in process on that. But we will continue to adhere to that and maintains the COVID-19 hotline that has been in place since last year. I want to just briefly touch on the vaccination data for Cumberland County. So you see that up on the screen right now. So of the eligible population to be fully vaccinated, we as a county have done exceptionally well. Over 80% of people in the county who are eligible. So that obviously excludes all of the children, under 12 years of age. So 81% are vaccinated. The current rate, this was from a couple weeks ago, I believe, the current rate of youth 12 to 15 is in the neighborhood of 60, and the youth 16 to 19, so most of the high school aged youth is 66%. So we still have a ways to go there. This information is being updated regularly. As I think the DOE will be providing reports at the school level on the percentage of students who are vaccinated sometime before the start of the school year, and that will be posted publicly for families to know what the rate is. And obviously that is in an effort to help us to motivate and encourage more students to become vaccinated. They will also be asking us to collect vaccination data for our staff, something that we've not had to do up until now. So this is what I think you heard about earlier. People commented on, the communication that we have started to send out to families last week. This is what we are proposing as our mitigation for this coming year. First of all, we are recommending that masks be used universally for all students on buses. Of course, that's a requirement from the CDC, but we're also extending it to all of our students and staff pre-K through 12 when they are indoors. At this point, we are not requiring masks when students are outdoors. For reference, that's how we ran summer school this year, and we felt it went really well, and so it's a continuation of what a significant number of our students have experienced over the course of the year. When we ended the school year, we were masking indoors and outdoors at all of those areas. So the relaxation of that is in the masks outdoors at this point. We are proposing that all of our staff mask when they are in the presence of students indoors, and that they, when it's adults alone, at this point we're saying that it's optional for vaccinated staff in other adult-only settings when they are indoors. Obviously, they could wear it outdoors as well, but we're saying that it's optional for our vaccinated staff indoors. And unvaccinated staff will be expected to wear a mask indoors when they are in the company of other adults, while everybody will have to do that when they're around our students. We will encourage distancing as much as possible, but we will not have any specific space requirements. As you know, that was the single largest barrier for us to be able to bring back our students the way that we're hoping to bring them back full-time and, all of them together. So, the extent to which we are required to maintain a certain distancing is where it becomes impossible for us to have all of our students back at the same time. So, that varies from classroom to classroom, from school to school, and from circumstance to circumstance. But, obviously, we want to, try to promote as much distancing as possible, but will not put down any specific requirements about that. The other mitigation layers, such as hand washing, open windows, ventilation, things along those lines, the ventilation improvements that we put in place last year, those will continue. We will continue to send home daily symptom screening reminders and, and asking families to monitor symptoms before they send kids to school, but also for us to continue to monitor for those symptoms and make sure that, anybody who is exhibiting any of the symptoms would be communicated with their families and so on. We are proposing to join the state's pooled testing program. For definitely kindergarten through 6th grade, we are looking at the possibility of doing that also with our pre-kindergarten programs. That's something that we're still working through, but definitely kindergarten through 6th grade. We are ready to go, and we'll talk a little bit more about that in a second. And then otherwise, consistent with this DOE guidance, we'll continue to follow the standard operating procedures for all of the quarantining and testing. And we are planning, and have actually done that this summer already, allowing parents, visitors, and volunteers in our building, and also allowing outside groups to use our buildings in the way that they have, the way that they had prior to the pandemic. Of course, any visitors will be required to follow our health and safety protocols. So a little bit more about layering of precautions. The mitigation layers that we're continuing are on the left-hand side. So the things that, we did last year that we will continue to do, including on-site testing and vaccine clinics, something that we started when the vaccines became available towards the end of the year, and that we will, resume now as soon as, we have students back in school. And then I thought it was important for you to see some of the things that we are, that we're limiting, that we're paring back. Things like the object and material sharing, the physical distancing requirements that I talked about earlier, as well as the strict cohort groups that we used during last school year. So a little bit about the pooled testing program that we're proposing. This is an added mitigation layer. So, just like we're reducing some of those things that you saw in the previous slide, this is a big one that we believe is helping us to open school more safely. This we're proposing to use for the kids, for the age groups that are students who are not eligible for the vaccine. So that's the pre-K through 6. I know that we're also looking at potentially doing all of the middle school. We're also looking at potentially doing this with our athletics and things along those lines. But specifically at this point, we want to do this with our kindergarten through 6th grade student population. So the way that this works is that students are grouped into a pool. And that pool is tested weekly. Students and staff are eligible. It's voluntary participation, so nobody is forced to participate in the pool. The test consists of, a nose swab, not the big, deep nose swab that some of you may have experienced with PCR testing. It's more of like a gentle, around the nose a couple times. And then those are taken in the classroom, supervised by our teachers. Then the PCR test is sent away, and within 48 hours, we get back whether there was COVID in any of those pools. Right now, they estimate that 1 in 100 pools comes back with a positive. So just to give you an order of magnitude, that would probably be a couple of positives for us on a weekly basis. When a pool comes back, everybody who is in that pool has an opportunity to be tested further using a rapid test, and that is done at the school level by our nurses. The state's vendor can also help us if we churn out to, like this accelerates and we have more testing than what we can keep up with. They would have resources to help us to do that. But at this point, we're envisioning that being something that our great nurse team would be able to keep up with. If a student who is in the pool gets a negative rapid test, so in other words, they are not carrying the virus, they do not need to quarantine. So that's the advantage of doing the pool, is that it reduces greatly if there's a pool of 18 kids, and once you get a positive in that pool, it turns out that one student was the one who actually had that. The other 17 students continue their learning, and the only student who needs to, in that case, isolate is the student who tested positive. Right now, anybody who's unvaccinated, so that would be everybody except for potentially the staff in those pools, who is not in the pool would need to quarantine. So they would automatically not be able they would not be eligible to go to Walgreens and have their own test. That's not accepted as, that is not accepted as a valid test. So those individuals who are not in the pool would need to quarantine. And, the definition, again, the current SOP calls for anybody who is within 6 feet for a cumulative 15 minutes over the course of the day would be considered a close contact. So anybody who's not in the pool and meets that criteria would need to quarantine. Again, if you were in the pool and you tested and came back negative, you would not need to quarantine. The way that we're envisioning operationalizing this is that from the teaching and learning perspective, anybody who is not in the pool who would need to quarantine would obviously not be in school for 10 days. For those students, we would be able to provide assignments and we would be able to provide feedback on their assignments, but we would not have synchronous or asynchronous direct instruction from our staff during the period of quarantine. So that's the plans for mitigation layers, including the pooled testing. We recognize that there's a tremendous amount of work that needs to be done to inform our community about this. We're prepared to do that in partnership with the Concentric folks, who are the state's vendor, to provide a parent university webinar. There's already in the packet, there's an FAQ about the pool testing program from the DOE. So there are a significant number of resources available around this, and we recognize that we need to do a lot of work to get those, to get people to consent to be a part of the pool. And we want to make sure that we get to the point where we have the majority of our students who are a part of that pool testing. Okay, so next I want to talk a little bit about the remote learning options. Again, I started by talking about how the CDC's guidance, and that's corroborated by our own, what we've learned over the past year and a half, is that, the best thing that we can do is to get students back to in-person instruction. So we will have a limited remote learning option available to individuals who have a verified medical condition that would prevent them from returning to school. So it's similar to what we currently do with any other medical accommodation. It would be a process that I'll describe shortly where, that request is made for that specific individual. So to be clear, we are not envisioning a large remote academy or even a medium-sized remote academy. We're looking at this based on the data that we have from last year as something that would be significantly smaller in scale. We're looking and have actually posted 4 teaching positions, and we would envision those 4 teaching positions having mixed age groups. So there might, depending on where the kids fall out, there might be one teacher who works with kindergarten through 2nd grade, another teacher who works with 3rd and 4th grade, and so on. So that's the way that we're looking at it. For high school, we're looking at providing the remote learning options through our existing alternative education options, using online instruction for that alternative ed options. In terms of enrollment, there is a Google form that we will be sending out shortly, available in multiple languages, that's been shared with our school staff and with our parent community specialists, and was also sent to families that were currently in remote academy, that were in remote academy last year. Once we get our applications in, we will review eligibility, and our target deadline is to have all of those placements made as well as the positions staffed by August 20th so that we know what that actually will look like. And so last but not least is, just the process that we've followed to date and, going through to your approval, hopefully on the 17th. So we've vetted this plan with our PPS medical personnel, so, with Tina and with Dr. Gita, with our administration and with our collective bargaining units. We communicated, as I mentioned earlier, to the community last week about our proposal, and you're reviewing it today. We'll make adjustments between now and the hearing on the 17th, again, prior to hopefully your approval at that time. So that's all I have, and if you have any questions, we can entertain them, and I would ask Tina and Dr. Gita to join me.
Are there questions from the board?
You raise first? You want to go ahead? I think she raised first, the student.
So my question is about the pooled testing. Since the pooled testing will be voluntary, will we be able to get an accurate estimate of how many COVID cases we have if it's not a randomized sample because it's just voluntary?
So they recommend that we have at least 30% for a good sample, and the company has said that level will give us a good idea of how much it may be circulating in the community.
Thank you.
Yeah, but it is voluntary.
Just to add to that, one thing that actually I think even down to 10 to 20%, I heard today on a CDC call, is actually shown to reduce transmission in other schools that have done this, such as Massachusetts. So even a small percentage can make a difference in the situation.
Thank you, Ms. Chung. I think actually Ms. Bondo and then Ms. Russell-Better.
Thank you, Madam Chair. I have a couple of questions. Thank you so much for the presentation, Superintendent. I think for the different mitigation layers, I see we have the ventilation and windows. Can we get some updates on some of those ventilation and windows from different schools? Because some of the high school, like during high school and Puerto High School, the ventilation and windows had a little issues a couple of years ago, so we just need to make sure.
Yeah, I mean, we did a lot last year. We haven't done much since then, so that's, I said that, the ventilation improvements that we made last year, but we have a complete spreadsheet that has every classroom in the school district and what, form of ventilation is available in that space, and we can give that to you again.
Okay, great. And the other one is about the screening symptoms. Everything went last year, where we get as a challenge for the parents to make sure they can have those daily screening before the student. Everything went fine for us to be able to use the same pathways. Did we get any barriers, any challenge? Then the school and the parents didn't have that great communication to get those screening at home, and then when they come at school, we figure out then the kids had the symptoms. So just want to know, because we're going to use those kind of layers. So we just make sure if everything we have done earlier, like last year, after evaluation, what we have overcome, what we see, so what we can improve for the fall.
So I think our system improved throughout the year last year as far as the the messaging for the home screening. It was definitely a bumpy start, but by the end of the year, I think we had a good, or by mid-year and so on, we had a good system in place, and so we'll use that again. There may be updates to the screening. I'm not aware now of what those would be. If there would be changes in the questions or the screenings, I think they would be essentially the same. But that system, I thought, worked fairly well once we got going, and parents really responded. I mean, they really wanted to keep their children home if they were sick, so I think that was a good strategy for us.
Are we going to use the same tools like texting, the messages? Everything went last year, so we're gonna almost using the same ways?
Yes, we are.
Okay. Yes. So my third question about the pooling, the pooling testing is going to happen weekly, and I know it's going to be challenging because that's every week. So those are the CDC requirement, or those are some other recommendation, or we proposing it?
So the state aggressively is promoting it. They contracted using their federal funding to be able to provide this at no cost to every school district in the state. So it is not a requirement. Not every school district in the state is using it. We, after talking through, and we considered this when we were looking at reopening high schools last year, and ruled it out. But I think given where we are now, we believe that it is an added layer of protection. And again, the thing that we have stressed throughout is none of these layers by itself is a fail-safe. It's the cumulative effect of having all of them that gives us a higher degree of security. And that's what the pool testing is another way for us to be able to keep our students and staff safe.
Do we have already, or are we working on that to put the structure in place? That pooling testing going to happen? It's going to be in the nurse office, it's going to be setting, or are we still working on putting the structure in place?
I mean, we have the broad strokes of the structure, and I think I talked a little bit about the fact that the pools will be, classroom based. So in most, elementary schools, 3 kindergarten, pools, and, the actual administration of the swab is done by the individual. So not the teacher isn't doing the swabbing, everybody is able to do that. And they then put it into a vial that the teacher does, screw and, close. And then somebody from the company comes and picks it up. They take it, and then 48 hours later, we get a report. When we get that report, then that is something that our nurses will have to, that they'll have to deal with it. So we will communicate with everybody that was in the pool that there was a positive in the pool, and ask them to come to the office to be tested using the Binax test,
Okay.
which all of our nurses are able to administer. And then if there are any positive, there will be, in all likelihood, a positive within that group. That person would be quarantined, but everybody else would be able to, go back to school and continue learning. The nurses would also have to communicate with everybody who is not in the pool to let them know that they need to quarantine.
Okay. So are we asking the little kids to that age to do the swapping on their own?
Yes.
So as doctor, I just want to understand, as the accuracy can be, asking a little child with that age to do a grade swapping and expecting to have a correct result.
Yeah, actually,
possible.
in other districts, when they do this, they found that the little kids are really good at this. And personally, from running the testing site that we had last year at 28 Portland Street for COVID, we did a lot of self-swabbing, and elementary school kids could do it very well. So they need to be taught. But across the board, that in other places that have implemented this, little kids kindergarten and up have been able to do this self-swab.
So the weekly, I'm sorry, I have a couple of questions. I just need to get it right. On the weekly basis, and then the little one keeps swapping on the same time, is nothing going to affect any issue on the nose and anything's going to be dangerous? No.
No, it's an anterior nary swab, so it's the very front tip of the nose. So there's no danger. Children often put their fingers in their noses, to be honest, and so it's not that different.
Okay.
I think, it's really important to recognize that swabs have changed over the course of the pandemic. So many of us who had, as Superintendent said, the back of the nose swabs, some of us have had the middle of the nose swabs. And, now there's more anterior nose swabs, and that's what pooled testing for the pool and for the follow-up testing is. It's the front.
Oh, okay. All right. My last question is about the special ed education, because I was concerned with those social emotion by them wearing masks. So I just wonder, as experts, how long we can keep those special ed education, those special ed students having the mask on without hurting already the trauma. And if we can use the outdoor, because I see we can be on mask with the outdoor, can we use the outdoor for our special education students?
But we can't use it only for special education students, and we can't have our special education students outside, all the time. We absolutely will try to have everybody be outdoors as much as possible, but we're not going to cancel school when we can't be outside. So, we did that last year. Our special education students were back in person for more time than our non-disabled.
So they did well.
It varies from student to student. And, we actually have, we've staffed appropriately so that we're able to do that. It's, there are some students that it's much harder than others, but, we will deal with it the way that we deal with all of the exceptionalities that our students bring. And, I'm confident that we can do it. We've done it before, and we will, we'll be successful again.
So for my last question, for the polling testing consent form, I know we're going to translate to different languages. The explanation should be only by translation, but the explanation should be more deeper, because parents need to understand the value behind and everything going on. So we just need to make sure. So that's going to be the multilingual. They're going to be in charge of explaining families, or it's going to be around any parent university only.
No, I mean, you have to do all of those things. So, obviously when we do parent university and webinars and things like that, we will have translations as we have. The forms will be translated. The forms are very highly technical, even in English. I read them and it's like, wow, this is going to be a bear to be able to explain it to people. So Dr. Valenzuela and her team have been they have those forms, and they are planning to do their outreach to make sure that all of our community.
So are we reaching out to families, communication? Are we sending those consent forms by text, emails, or mailing?
We're just getting started, Ms.
Okay.
Bondo, don't get ahead.
So I get an
So
update. Thank you
we're-
so much. Yeah, thank you. Thank you, Madam Chair. I'm done.
Thank you, Ms. Bond.
You have not approved this yet, so.
Thank you, Ms. Bondo. Ms. Russell Better.
Thank you, Chair. Thank you, Dr. Gita and Nurse Felu for being here tonight. Appreciate that. And for your presentation, Superintendent. So one of my questions was about collecting staff vaccination information, and I believe, Superintendent, you stated that as a district we don't have that, but that the state is going to be requiring that schools do that. So I was curious if you can share anything about when that may be happening. Do you know what that process is like yet or not?
We don't, this was unveiled last Thursday,
Okay.
that we would be collecting this information. They said that they would provide us the template to do our reporting, before the start of the school year, and that we would be doing it monthly.
Okay.
We don't have anything beyond the fact that we're going to need to do that.
Okay. And so once that happens, will that be something you'll be sharing with the board, with the community? I'm just curious, and I guess
that's the purpose of it, is
Yeah.
the state will publicize it, so
Okay.
obviously it will be visible to everyone.
I'm just curious, and maybe we don't know this yet, but I just am curious about having that information before the school year starts. And I'm also curious, and you may not know this, but, is that just, voluntarily sort of honor system that folks are sharing that? Or are we requiring them to share evidence of that? Do we know that piece?
I don't know that.
Okay.
I don't know if they've given any additional details on any of those calls.
No, I don't.
I listened to the briefing with Dr. Shaw, and they talked about it would be done through a system a survey in which staff aren't individually identified. So I don't believe there would be any verification, and the information would all be, would not be tracked back to individual staff members.
Okay, but it would give the number of staff or percentage of staff. Okay. And then in addition to that, I just, Superintendent, when you were talking about in schools, when school's in session, that if adults were to meet, and also I believe that's a new policy, right? Because weren't staff members not meeting together, right? Like that was discouraged, or maybe even, meetings with staff. So that is a change for staff to be meeting in person. And I guess I'm concerned about the option to mask, because I again feel like, how do we verify who is or isn't vaccinated? So I guess I'm just curious, is that also kind of the honor system that, I could imagine a scenario where perhaps one staff member would say, I'm not comfortable with us not masking, so hopefully there would be that, collegial decision to be made, but I guess that I feel a little uncomfortable or unclear about how that, how do we know who is vaccinated in that scenario?
Yeah, in our current scenario of that, it is on the honor system. And, again, just asking, the reality is that the person who's most at risk of contracting COVID is those who are unvaccinated. And so it behooves, someone that is not vaccinated to wear a mask. It's also judgment-free, and anybody who wants to wear a mask at all times is fine to do that. Nobody's going to ask them if they're vaccinated or not vaccinated.
Mm-hmm.
They're wearing a mask. And I will say that all of this is subject to being reconsidered. Today and yesterday we had our administrative retreat. We intended, to be unmasked, which is what we did when we had our end of year last meeting with all of our staff. And, we reconsidered that, and everybody wore masks for the last 2 days, just because, we're learning more and revisiting this. So we will continue to do that. And, I hear your concerns, and I think they're shared by many. So.
Okay. I think I just, in a scenario in which, we have a staff person, I don't feel like a person should have to share, their medical information, but they may feel the need to do so to make themselves feel safe to be in a situation meeting with other folks. So I guess I'm just thinking in that scenario, that can really put someone in a difficult position. So I guess just considering, I just would ask us to consider, when we have across the board rule, it just kind of keeps vulnerable people feeling protected. So that's just where I'm coming from. And my last question was just, Superintendent, I didn't hear, I don't think, anything about like school-wide events or activities. So I was just wondering if there's anything different this year that's been decided about that. Is that going to be in buildings?
We have not made a universal, we have not made a universal decision around that. I think in general, we want to reduce the number of crowded situations. We can do things outside. There's lots of different options. So we don't have like a across-the-board pronouncement, but we definitely, again, one of our mitigations is spacing to the extent possible. And so that's something that we can avoid, is bringing everybody together into crowded spaces. And, so we'll attempt to do that, but that's also a big part of creating community in a school.
Yes.
So I think there's going to be a balancing of all of those things.
Okay, thank you so much.
Ms. Chung,
Oh, I think Mr. Burke had his hand up and I asked.
I'm going to go ahead with both our students, and then we'll go back to adult board members.
I just have a quick question about the alternative education option, because I saw when we were talking about remote learning, we had an option, or we had 4 positions for like pre-K through 8, but it said like alternative ed for high school students, and I was just wondering what that would look like for a high school student who had like a certain medical condition. They couldn't learn in person, if that would be a disadvantage for their learning this coming year.
I mean, it would be the only alternative that we have, right? If they can't be in person, they need to have a remote option. And in the case of the high school, because we already have staffing that's dedicated to alternative education, it would be those staff that are providing the additional support to those students.
Okay, that makes sense. Thank you.
Okay, it's a really quick question. So are all of your proposals that you're for this year, are they all based off of CDC recommendation? Like if the CDC were to say increase restrictions, would you also have to do that?
I mean, if they were mandates, yes. If they were recommendations, no. But again, we will continue to evolve what we do based on, the information that we have, both the requirements. Like in this particular case, masking is not required. And I don't know if you were here, Haley, when we had, someone from the public, or a couple people from the public, said that they didn't think that we should be asking our students to be masked. So we've gone beyond what the recommendations are in the case of masking. So, we will continue to look at, everything holistically and bring back any changes as we did all through last year. But definitely, if somebody were to say, you have to do X or you have to do Y, we will definitely, obviously do that.
I guess I'm just asking, I'm trying to see how this is going to play out, because I know it's getting worse, and I just I want my senior year, but that's relative. Everybody did. Everybody wanted their senior year.
Yeah. And we hope, you can't believe how much we hope that you will have your senior year. So.
Thank you so much. Mr. Burke, do you mind if I go first to Mr. Rodriguez?
Please.
Okay. Mr. Rodriguez. And then maybe if board members, I know this is new for us in terms of indicating not via Zoom when we want to speak, so if you can make sure that I see, then I can make sure that I'm fair and in the order that I'm calling upon you. But I do like to prioritize our students, so I will continue to do that. Mr. Rodriguez.
Thank you, Chair. Thank you, Superintendent, for the presentation and update. I have a couple of questions, mostly about the pool testing. The opting out, I guess, process would be in the waiver form, or how would a family that wants to opt out, how would we know about that?
How would they opt out of pool testing?
Yep. So I want to make sure the teachers are aware.
You have to opt in.
Oh, okay.
So you have to consent. So the only people that will go through the pool testing are people that actually have a signed consent form that allows us to have them swab.
All right, good. just want to make sure that we're not, that we're following any family's, preference if they choose not to, that we're fully prepared to, that the teachers know exactly which students have opted out of it. You mentioned earlier that we're going to also use it for athletics. Is that going to be in the higher grades or only also for the K through 6th grade?
We're looking at it as an option for athletics. We've just had hey, maybe this would be a good thing to try, conversation with the ADs. So that's all that we've done, and it would be for the high school in particular, where there's traveling and, things along those lines, where, oftentimes the whole team would be quarantined because of a positive, and this would give us a way to sort of, more narrowly identify who would need to quarantine.
Good. We've not done any pool testing before, right? Good.
That's right.
On the question of teachers administering or guiding the students through the self-administration of the test, you mentioned that the process of coming up with these recommendations in this proposal included communication with the bargaining units. I was just wondering what the PEA's and EdTech's feedback was in that regard, that they're going to have to supervise young children.
I mean, I think we don't envision it being a very significant draw of time and resources. It is, basically lining up the kids and, making sure that they swab and put it in the vial, and then closing the lid on the vial. And then somebody will have brought it to the classroom, somebody will take it away from the classroom, so it won't be the teacher's, job. All they have to do is just make sure that the kids are actually swabbing and putting it in the vial.
Yeah.
So they were okay with that.
Yeah. So that, to me, like when you explain that to me, that seems like a really reasonable thing to do. I have a healthcare background, so I specifically wanted to get an insight into what was the feedback from the teachers when that was presented to them.
They were okay with it.
All right. And then the other question was on the students that choose to not participate in the pool testing, in the event that they're deemed close contacts. Is there any difference between the quarantines that they have to serve and the students that are participating in the pool testing?
So once the positive is identified, we would do the contact tracing, and anyone who is a close contact would have to quarantine unless they are in the pool, because they're going to be continually surveyed every week. So those students who are deemed a close contact that are not in the pool would quarantine the 10 days. It would be the same standard, the same thing we've been doing for the past year.
So just to make sure I understood that, the students who are participating in the pool, if they're deemed close contacts,
That they would have to be tested. I'm sorry, I didn't say that. They would get a rapid test by the nurse at the school. If that's negative, they can continue to go to school. They do not have to quarantine.
but a student who's decided not to, obviously, if they're deemed a close contact, they have to be quarantined.
They have to quarantine, right.
Okay. And so then my last question was about the way that we're going to give assignments or continue education for those quarantined students. So you mentioned the students will receive assignments, but there'll be no remote, nothing like what we were doing last year capacity-wise, as synchronous remote opportunities.
That's right.
It seems, given the loss of educational time that our students have already experienced over the last year, this seems, like further to create further inequities, particularly when we are, should we have some students that decide not to be included in the testing for whatever reason, those students could, if they're deemed close contacts, could be exposed to even more loss of educational time. And if we're only giving assignments and not, the same intensity or rigorous educational, time that the other students will be receiving, I worry about that. So I guess
it's a choice.
It is a choice, but it's also our responsibility, to provide the same opportunity regardless of the choices that our families make. So I would say, is there anything that we can do to give more or stronger support on those quarantine episodes, which will be 2 weeks of length for each student.
That's the only way that we envision doing it. Otherwise, it's doing two things. One, it's placing an incredible burden on our teachers to be able to teach the kids that are in school because they actually were a part of the pool and tested negative when they got the Binax, and then figure out how to support the kids that made the choice, or their parents made the choice, not to be in the pool and, are now home. And so that's specifically why we decided to do it that way, because it would be incredible. One, it would disincentivize anyone from being in the pool. And two, it would create an incredible burden on our teachers. And that is, from my perspective, and I think it's shared by, our teachers, it would be incredibly unfair on the students who actually are in the pool, that now they would need to sort of somehow split time with, the students who are home because they're quarantined because they were not in the pool. So I think that's our theory around it.
Yeah, and I think that makes perfect sense if that's the length of the options that we're willing to explore. I'm wondering if there's something outside of, further burdening that classroom teacher to give those students a little bit more support than some assignments on Google Classroom. I do agree with what you're saying, that burdening the classroom teacher further, it's unacceptable.
Yeah.
I'm just wondering if we can think outside of that.
We'll be happy to look at other options. There's limited things that we can do.
I would like that to be the case, and if maybe before we vote on it in our next meeting, if at least an option that addresses that concern is presented.
And if you have specific suggestions that you want to offer, that would be great.
Oh, Superintendent, that's a tough one. You know why? Because
I know, that's, but I guess, I said, I'll look at what those options would be, and, we'll be able to share what we have come up with. Nothing jumps.
So the reason I say it's a tough one, Superintendent, is because, on a process that started several months ago that included so many people, that included in our entire operations, I don't necessarily think that I'm capable of giving you a sound, option. I don't have the privilege of the information that you have access to. So I don't know that pushing it back on me is...
No, I'm not pushing it back on you. I'm saying if you have any specifics, if there's something, because obviously you have a preference for that. So if there's some idea that you have, I'd be happy to take that into consideration. But I also said that we will look at what other options might be, and, we will report on those as part of, before you vote.
Yeah, that'd be great. And just to be clear, I have a concern for the lack of educational time our students could be exposed to, not a preference for anything else. And I guess I did have one final question, just to clarify. Is there going to be spacing requirements in our buses?
No, we're gonna go two to a seat and have windows open, which is the guideline that we've received. Yeah.
All right, perfect. That's it.
Thank you, Mr. Rodriguez. Mr. Burke, thank you for your patience. Go ahead, please.
Thanks, Chair. Please always prioritize our student reps, and you got the order just fine, no problem. Superintendent, thank you. I have a question to check into some part of a conversation that I had before. The CDC recommends right now, does a mandate that vaccinated adults mask up indoors again in high transmission counties. We're currently moderate. If Cumberland went to high, what would you do?
Again, we're seriously considering that even with moderate, so I think that was Ms. Russell-Better's question, and I think we're, again, we just had our administrative retreat and everybody was masked throughout that. Clearly, if we went to high, it would be, following that recommendation, but, at this point, even with moderate, we're considering that as an option.
Okay, thanks. Regarding the building use by outside groups and visitors, et cetera, do you expect that to take effect, or when do you expect that to take effect pragmatically? Like immediately the first day of school, there's certain groups that we know, I'm trying to think whether it's our Learning Works, our partners that provide before and after care, or is there going to be a staggered nature to get the schools open, get started, and then allow outside groups to begin using buildings?
It's, for some of those groups, it's already started, and we do have other groups that have already filed their forms that we are in the process of reviewing and approving.
Okay.
So we're not, specifically to answer your question, we're not staggering it in any way. Some of those organizations like Learning Works and others that are in our schools regularly, those are, have been in our schools this summer, and they will continue. And then, some of the ironworking session that rents space here at Paths. If they apply, they would be reviewed and, likely approved in the way that they were in the past, and following the specifications that, the health and safety guidelines that we have in place. So with masking and things along those lines.
Okay. And with the visitor question, if I had an appointment with a principal at my child's school and we were meeting in their office, then I could take my mask off in that meeting with the principal because I'm vaccinated? That's how that would play out right now?
That's a good catch. Under the current guidance, that would be right, yes.
Okay. Per the question with the honor system and stuff, I'm just curious what staff's feelings are about that, wanting to have to be responsible for knowing that or making those decisions for themselves, just per the stress levels that we all carry. With being outside, this thanks for all that we've done there. Just curious if there's more in place to make it easier for teachers to get outside beyond those teachers that are most comfortable and feel prepared to get outside. If our outdoor learning director has, helped operationalize anything that will help more people get outside more often, that sort of thing.
They started yesterday.
Oh, okay.
So
that should be figured out by now.
Yeah,
No,
so I think by Friday they'll be ready.
Good, great.
Thanks. Was Malia here?
Mr. Youssef.
Oh, I still have more, I'm sorry.
I'm so sorry,
That was just a
Mr.
very
Berg.
friendly banter about a very easy thing to figure out, getting figured out. Yeah.
Please go ahead, Mr. Berg.
Okay, so nothing else is formally in place to help teachers get outside more easily other than the infrastructure that was put in place last year?
I think you know that we did a significant amount of work last year and that we have a strong infrastructure, and, we will be able to build off of that. Nothing additional has been put in place, but, we do have a really strong start on that and feel really confident that people understand, particularly particularly at the, in the, summer, fall, and spring, that we had a lot of activity outside, and I think that will continue. And, we obviously have the additional resources now to be able to make that possible.
Okay. All right, on to pool testing. I looked at their website, it's very slick, I can pick my nose, I can take the test. The steps look simple enough. Up into register and ship, I'm just wondering who's going to be responsible for the registering and shipping of the vial? Is that going to be per teacher, or is a nurse collecting the vials and doing the scanning and packaging?
The state has also resourced the company to do that, so they, part of our discussions with them, to get us started was we didn't want to be the ones doing all of that. That is a significant amount of work for our nurses, for our staff, and so on. So none of the scanning, none of that is being done by school staff. This is being done by staff from the vendor.
Okay, so what it stands is the teacher is responsible to say, the supplies are somehow going to be in front of the students. Teacher says, if you're in the pool, get ready, and the kids will butterfly open their strips. They'll pick their nose with the swab, and they'll drop it in their tube, boogers down, and they'll put the tube, with the cap into the thing will go into a collected tube, and then a company is going to come around and scan and put those in the biohazard bags and ship them out. Okay, that's very helpful to understand, thanks. Do we know anything about, this is me as like consumer beware and, being somebody who grew up in Facebook and realizing all the liabilities with what can be done with data and privacy. I didn't see anything on the website that directed this directly, but is there anything that we know about what the company is entitled to collect, store, or sell in terms of data from these pool tests?
Let me just attempt to answer that. You know, as I mentioned earlier, we had, before the state had actually engaged with this company. This is what we were looking at when we were looking to reopen schools last year. And so we had gone all the way through with an agreement that had been, you know, reviewed and approved by our attorneys and their attorneys. And so all of the concerns that we would have on our end were all addressed under that. I've not gone back to look at, you know, is their new agreement different from, or is their state agreement different from the one that we would have entered into? And we will definitely do that. And obviously, we want to make sure that we're, you know, that we're adhering to all of the FERPA and HIPAA and all of those other requirements. I don't know if you have any other insights into that?
No, nothing to add. Okay, thanks. But I'm curious, where's the reliability in terms of accuracy of testing at this point, if we're going to rely on pool tests and then the individual follow-up for quarantine protocols? How reliable are the tests these days?
So the original pool test is a PCR test, so it's very reliable. It's the gold standard of testing. And then the follow-up testing with Binax is an antigen test, so it works best when viral loads are higher. When they looked at this data in Massachusetts, if you had a pool that had a positive PCR test with the Binax testing done within 24 hours, I think it was like 89% of the Binax tests, or 89% of the pools, the Binax test found the positive. For ones that didn't find the positive, they retested the next day. And it was 94% of cohorts at that point who had a positive, the Binax found the positive. So it's not 100% perfect, as antigen tests are not, but it's good. And so the PCR test can catch, you know, a positive before someone is showing symptoms. So the idea is that and then the Binax test is likely, you know, within a couple of days to find that positive. So it sort of ends up being that you find a kid who has COVID potentially, or a person who has COVID potentially before they have more days in school to spread.
Okay, that's helpful. Thank you. And one more test or question. Oh, I have two. With the pooling, and per Member Rodriguez's comments, will we collect disaggregated data in terms of who's participating in the pool and who's not, so we could track any disparities in terms of days out of school over time with that quarantine issue?
Yeah, absolutely.
Okay, thank you. And then to our healthcare professionals, I'm just curious, is there information coming forward about a relationship between masks and emotional or mental disorders such as anxiety?
So I don't specifically know any studies on that, although I know that that it is being looked at in terms of the social and emotional effect. I mean, the social and emotional effect on kids in this pandemic has been tremendous, right? People have been isolated, people have been at home. It has been very hard, and it's been hard for families. So I think, you know, prioritizing the in-school return is the utmost priority. And masking is one of those things we need to do as a layer in order to be in person full-time, especially because distancing cannot be perfect, you know, to get all of the students back in. So, you know, yes, certainly, like I think that masking is hard for some people and is not ideal, but I think that the pandemic and all of those other factors that affect children's mental health and social and emotional well-being have affected people deeply, and getting people to school and whatever it takes to do that is and with all of the social work supports in school and in the community, the best way to support families and in their mental health is to have kids attend. And I think, you know, masking is needed, and the CDC is going even further now, really recommending masking for vaccinated and unvaccinated people in their changing guidance. And so I think that it's just critical, and that everything we can do to put the other social emotional supports in place while people mask is important.
May I just lean in a little heavier? Just because in my household, masking's not a issue. My kids do it with compliance. Of course, we all enjoy not wearing a mask. It's not like it's our preference, but I just don't have direct experience with where it is a challenge. So just anecdotally, experientially, since you interact with so many more people than I do, that anything to help me understand why masking is difficult for some people would be helpful, because it's just not my lived experience.
I mean, I less on the social emotional side. I think on the learning side, it's particularly challenging working with students who are learning English and, would benefit from, facial expressions and, seeing the word formation in your mouth and things along those lines. So I think that's very real. I think there is, I know my wife is a psychologist, and, when she works with students who are on the autism spectrum disorder, that she won't mask when she's testing those students, and she'll do her testing outside because she just knows that to be able to engage directly with someone, it's different for some kids than others. So I think that those are some examples. I don't know specifically around anxiety. I think, I think Dr. Gita said it's being looked at, but it's also, just the whole experience of the pandemic is anxiety producing. So I don't know how helpful that is, but those are a couple of examples where I think the mask does actually get in the way of the education. So.
Okay. Yeah, thanks for the time.
Thank you so much, Mr. Burke. Mr. Youssef.
Thank you, Chair. Thank you. Most of the questions I had been asked. We talked about remote learning option for students. Is it also for teachers? Because I remember that was an issue for teachers with accommodation and verified.
So we're working through the staffing for those positions. So obviously, if there was somebody who was, had a medical condition that would prevent them from, to working in person, that those people would be given consideration as part of the staffing process. So we're, Ms. Stoddard and her team are looking at that as part of the staffing for the remote academy.
Oh.
And then obviously anybody who has accommodation needs, we always review those through the legal, HR process, and we'll continue to do that.
We require all the students have masks indoor. Technically, when there's lunchtime, is there a way we can have? Is there a preparation for alternative meal spaces so that we can have students distancing each other, like, for example, outdoor?
Yeah, I mean, we're working through all of those issues. Again, it varies from school to school. We are not putting in place a requirement that students have 3 feet between students when they're eating, or 6 feet between when they're eating. So that is something that we just cannot uniformly say we're going to be able to do, but we are absolutely looking at having some students eating their meals in the classroom, having some students eating their meals outside, so that we reduce. We are absolutely going to try to keep as much distance as we possibly can during meal times and during all times, but we cannot make a commitment to do that uniformly and then and say that we can have all of our students in school.
Yeah, thank you so much. Okay.
Thank you, Mr. Youssef. Ms. Bondo.
I have a follow-up question with the work assignment when we're sending a student on quarantine. So are we are we already thinking about, they're going to be in 14 days quarantine at home. So are we sending a full package for the work assignment for them to be at home, or are we going to rotate those assignments weekly? Because it's going to be already a learning loss, sending them without any remote learning. So that means, are we going to rotate those assignments, those work assignments weekly for them to be able to stay on the top of their learning, or are we going to send the full package at once and let them just figure out on their own?
It will vary from class to class and teacher to teacher, depending on what is being taught in the class.
Right.
So we can't say that it's going to be, you're going to get everything, for, 10 days out. We don't know exactly how that's going to go. In every different class, it'll be different.
Okay. Can we get some update as soon we figure out some of the structure, just to have ideas?
What would you want?
Just to make sure then when they have those work assignment going, when they're going to be on quarantine, if the work assignment can be a full package for 14 days, or it's going to be a weekly rotate?
It will vary from class to class,
Ah, it's gonna be
depending
cla-
on what
okay, I
is
didn't
being
hear
taught
that.
in that class. I can't update you beyond that because we're
Yeah,
dealing with a hypothetical situation.
Yes, see, I didn't hear your answer right. That's why I'm asking again. And yes, thank you. And then after the quarantine, do those students need to be retested before coming back to school, or they just come back to school after the 14 days?
Yeah, well, testing would be recommended. Hasn't been absolutely required if they are without symptoms after they've completed the quarantine period.
Oh, okay. All right, thank you. Thank you, Madam Chair.
Thank you, Ms. Bondo. Ms. Russell-Better. I have questions, but I'll wait.
Okay.
I just want to be clear, it's 10 days, it's not 14 days.
Oh, 10 days. Oh, thank you.
Thank you, Chair. I just had one question I thought of after Mr. Youssef just was mentioning, mealtime. I mean, that's a new scenario, right? I feel like part of how we kept our schools really safe, especially at the elementary level, was not having the meal, right? So I'm thinking about that scenario. And I just am wondering, especially Superintendent, as you're saying, it really doesn't feel doable to have a very structured, right? Like this is the distance we're asking for, and this is because it's different in every building, right? And how, so I guess I just had a question for medical staff regarding what your thoughts are around the idea of vaccine mandates for staff, because part of what I think about in the pre-K to 5, right, when we know none of our students have that layer of protection of vaccine, I know that our numbers that I had seen in the past about, I think it was more teaching staff, we have some pretty good numbers of staff being vaccinated, but I wonder about other staff that are, front-facing with students, and I think about when they're unmasked. I mean, that's the time that I really am concerned about, that period of time when we have all these young students that are not vaccinated being unmasked. So I'm just wondering what your thoughts are about the idea of mandating vaccines for our staff.
Just one thing, when you talk about the lunch, the staff wouldn't necessarily be unmasked. It would just be the students eating.
I'm sorry, say that again?
Right? Well, talking about the lunch period, that the staff wouldn't necessarily be eating with the students. So the staff wouldn't necessarily be eating, so they may not be unmasked. So anyway, and I don't think we're at a point where we can mandate it for staff. It is still under emergency use.
Yep.
So I guess I feel like we're not quite there yet to mandate it, but we certainly want everyone
thank you. I think it's just
vaccinated. I don't know.
helpful for me to know, is that something, say, we are getting to, numbers that we are in red, and if we do get that information back, Superintendent, when the state is having us do the data about vaccination, I think my concern is also, numbers might be good across, but how do we know in a school building, right? In one building, might we have a number of food service workers that, I'm just giving an example, but, and that is true. I understand the staff being masked, that is one layer, so that is helpful, and I wasn't thinking of it as that, that's one layer if staff is masked. But it does just make me think about many little children without masks for a period of time, and then potentially staff that are not vaccinated, and that just, makes me nervous, so.
But the
I guess-
staff would all be masked, so.
Yes.
Regardless. And just on the vaccine mandates, we're not, we're not considering that at this point, but we will, continue to look at that as it evolves. The Justice Department said the other day that they believe that you can mandate it, even if it is emergency approval.
Yeah.
I think we should wait to get our data, get a
Yep.
better sense of what our data looks like. Again, you saw what the numbers look like at the county level. When you look at the zip code level data, it looks good for Portland. So I think that we have a significant number of our population that is vaccinated. And as we get better data, as we do these reports that we're going to be required to do, we'll have a better sense of whether that is, necessary or would actually add anything
Okay.
other than aggravating. And I do want to just remind everyone that we have like 10 open positions in our custodial staff. We have, 10 open positions in our food service staff. Those are hard to find positions. So, to the extent that we, decide that we're going to require a vaccination, and that could potentially lose us people as well. So we have to weigh all of those things as we make these decisions. We have, everybody has a shortage of substitutes. If we start ruling out substitutes because they're not vaccinated, we're going to have a lot of classrooms unstaffed. So those are all the kinds of things that we've got to weigh as we look at
Well,
them.
thank you. That is helpful to just get my head around some of the reasoning that wouldn't, it's not something that I'm certain how I feel, but just feeling strongly about wanting those layers of protection and just the picturing mealtime to me felt like a more risky scenario. So I just appreciate the plan of kind of as this whole process has been, right? Like being able to pivot and shift and look at other possible avenues to add those layers. So, but I understand for now that has a lot of reasons that wouldn't make sense to do so. Thank you.
Thank you, Ms. Russell-Better. On that thread, I have a number of questions, and I'll start here by saying, I think I'd be more interested in requiring vaccinations for our students, given that the rates in Cumberland County are lower among youth than they are among adults. So once the vaccine gets, final approval, full approval from the FDA, I'd be interested in looking at where our rates are, and certainly considering that, given that we require vaccinations for lots of other diseases in order for kids to come to school. I wanted to ask and maybe just emphasize or confirm that as has been the case throughout the pandemic, we are responding to the latest science and information, and the plan will continue to evolve as the pandemic evolves and as the science and information evolves. I think, we didn't anticipate being here when school ended. We thought we'd be in a better situation, having to take fewer precautions. So I just want to give you the opportunity to talk about, this as a evolving plan that will continue to be based on the best information and the latest science as the pandemic evolves. And, clearly right now we're seeing this latest Delta wave because there continues to be so many unvaccinated people in the country, despite the availability of the vaccine to most people. Want to acknowledge that it's still, for marginalized communities, still can be very hard to access. But we didn't foresee being here and having to, for instance, continue with masks for older kids this year. So anything you want to say to speak to that?
As recently, and I think I mentioned this, but as recently as, 3 weeks ago, we thought that we would be coming back with masks at the elementary grades because of the lack of vaccines, and not at the middle school or not at the high school level for sure, and maybe not at the middle school. So, I think this has been evolving, and, it will continue to evolve. I think that's one of the things that we've just, had to do throughout this process, so.
Thank you. And then my understanding, and I don't know if there's any data on the specifics, and Dr. Gita, I'm sorry if you spoke to this already, but my understanding is that pooled testing reduces both school and community transmission. And do we have data on how much it can reduce transmission within either the school or community?
Yeah. So there are multiple reports on this. I have looked at them. So there's a Rockefeller report. In one community, they had estimated that there was potentially reductions in school transmission up to 50%.
Did you say 5-0?
Yeah.
Thank you.
So, but this is all, I am not an expert on this data. I am happy to look at the report and, pull out some clips. And in terms of community transmission, I don't really know the data, but I'm happy to look.
Okay, thank you. And then my understanding as well is that there is some recent data, and I learned about this on last week's briefing with Dr. Shaw, specifically on the briefing for school communities. And I was very interested to hear that there's new studies coming out that show that kids collecting the swabs is actually more accurate than adults collecting the swabs. And I was just wondering why that wasn't intuitive to me. And so I'm just wondering, what your understanding of that is.
So, I think it makes a lot of sense, just because kids like to be in control of their bodies, and so the idea of them putting something, into their face or on their body is more comfortable than like an adult coming at them, especially someone who's wearing a gown and, face covering and a mask, and who they're not familiar with. So I think it actually makes a lot of sense, and it's definitely my experience in doing a lot of swabs, that a kid would, if you stand back and watch them and you can coach them, but that it feels more comfortable to actually have them be in control, or even to gently guide a hand.
It was so interesting because it sounded like from the description of the studies that it was kids as young as kindergarten, and showing that showing again that the kids were very effective at collecting the swabs. I just want to confirm that we're including staff in the pools.
Yes.
And what about staff who might not be in classroom pools? Is there, I know we're targeting people who don't have the ability to be vaccinated. So would staff who aren't in a classroom pool also be pool tested?
We haven't really thought it through. There's nothing that would prevent us from doing that. It would obviously be voluntary, and it would be sort of redundant, I guess, to some extent. If people who are vaccinated are actually doing it, there would be no impact, of it. But I think that's something for us to talk about and try to figure out.
Yeah.
But we are thinking that in those classrooms, just, if nothing else from a modeling perspective, just that, the teacher's also doing it as well, so.
Okay, thank you. And then I know at some schools, the outdoor tents came down, and I'm wondering, will those go back up?
Yes, they will.
And be used in a similar manner to?
We're working through that. So.
Okay. And then my last question is around outdoor learning at the 4 BFOF schools, the schools that are undergoing renovations. I know we already already had to address this challenge to the extent that it's a challenge. Maybe there's a lot of space outside at Lyseth, but the other 3 schools, will we evaluate additional outdoor learning opportunities working around the construction?
We will. It's obviously harder at Reiki and at Brezomscott than it is at Longfellow, where there's a significant space in the Deering campus and so on. So, but yes, we will, and it will absolutely be harder, and
And is there, for instance, at Reiki, the places where the outdoor tents were last year, there's now construction, which is amazing and makes me smile. However, recognizing there's not really space for them elsewhere. Will we talk to the city about using fields? Like Reiki has a big field on the other side of the school that could accommodate tents.
Of course, yes.
Okay, thank you. Yes, Ms. Hill.
Thank you. Okay. This is like kind of an irrelevant question, but like, what are you doing in this situation of like field trips? I mean, like, Casco's an expeditionary learning, so we do a lot of expeditions. We're out, you know, like Senior Quest is a thing, and I'm sure Deering and like Portland do a lot of those things too. Or no, maybe not. I don't know. But like, what are you doing in that situation?
So again, it's situational. It's one, each of them is looked at the school level and so on to make those decisions. So I know that Casco is very excited about, restarting their field trips. We don't have prohibition against them, which we did last year. So obviously we'll have to figure out how to do it safely under the circumstances. So.
Great. Thank you.
Mr. Burke.
Thank you. I think this is a quick one, just on the same and different slide that you had. I don't think this is a state mandate anymore, so just want to double check though. Well, after traveling out of state, there used to be a quarantine protocol that's no longer in place at the state and no longer a protocol for the district, correct?
That's right.
Right.
Okay, thank you.
But I would just say we would continue to evaluate, and the state has said if they would reinstate quarantine, from certain hotspots. They haven't set what that criteria would be, but, we would continue to look at that. But as you said, right now, there's no restrictions.
Right, so we'd rely on the pool testing, like after a school vacation, to try to catch it, that sort of thing. Okay, thanks.
But just reiterating, the pool testing is for K through 6th grade.
K through 6 only.
Or pre-K through 6th grade.
Okay, thank you.
Are there other questions from the board? Mr. Rodriguez.
Yeah, I just have a couple of really quick follow-up questions. There's no waiver of the number of educational days that the Department of Education expects from districts, right? Like there was back in 2020.
It's a good question. I don't know. I should check that.
Yeah, it'd be good to know. And then my follow-up question inevitably was going to be about attendance for quarantine periods. Given that normal attendance, I think as I was looking through the DOE page, is taken a half of the required day if the student is away from the classroom. I don't want to get into.
Say that again.
I may have been just browsing too quickly, but I want to make sure that the attendance, that we're granting attendance, educational days for kids who are quarantined appropriately.
Yeah. Those are, yeah.
And again, my sense or my concern is that they wouldn't be really receiving a full educational day. So giving them an attendance day seems, it doesn't seem to meet the criteria for what a full attendance should be. But again, I would have to see.
So that would not be considered an attendance.
So those, okay. So, okay. I guess I just want to understand that. They'll be expected to log into Google Classrooms, do assignments, but they would not be.
And they will
present.
be given the opportunity as, the same as a student who is sick, right? They will be given the opportunity to make up any work. So if they don't do any of it while they're in quarantine, they will have an opportunity to make it up when they come back to school. And to receive support and instruction and all of those other things. But what we're not, doing is providing, 2 tracks of instruction, for those students, because it's, a decision that they made to not participate in the pool testing.
Yeah. I will see. The reason I'm asking these questions, as we see numbers increase, the number of cases, I would suspect that we're going to encounter either at one point a surge of the number of quarantines, much like we did last year when there was surges within the community. We saw a surge in the number of quarantine or close contacts in our schools. So I want us to be prepared should we see the numbers increase so exponentially that we're forced to another, God forbid, a remote academy scenario.
Yeah.
So to hear that we don't have, a backup plan right now for quarantine, it's not necessarily.
But again, I think that the part that's really important for people to understand about the pool testing is that it reduces the number of people who miss school as a result. That is the benefit of having people participate in the pool testing, is that where before anybody who was in that class within 6 feet of the person who, came up positive had to be excluded from school. In this case, anybody who's in that pool that tests negative when our nurses give them the Binax, those kids can continue learning. The ones that won't be learning are the ones that weren't in the pool and therefore, have to be quarantined. And those are the ones that, that's a choice that people are making. And that's, I think, part of our drive to do this is to reduce the number of people who will be quarantined out of school. That, we didn't have that tool before.
Okay, I understand what you're saying, Superintendent. I don't disagree with what you're saying. I'm simply raising the concern for the kids who will experience more frequent quarantine periods. Whether that's a really small contingency of kids or not.
The number one intervention that we have for them is to participate in the pool testing.
Also, Mr. Rodriguez just emphasized the high rates of vaccination among adults in our community and a pretty good rate among youth. So,
I just want to penalize the kid for a decision that their parents made.
I understand your concern, but we're in a fundamentally different situation this year than we were last school year before vaccinations were widely available. Ms. Russell-Better.
Thank you, Chair. Superintendent, I just thought of a question regarding the consent about participating in the pool. So would that not be asked of families until school starts and that happens, or will we have an opportunity? I would just be curious to know, kind of in response to Member Rodriguez's question, can we find out earlier, what the numbers look like for families opting in or out?
Our goal is to be ready to go on the 18th.
Okay, so that will be, and I apologize, I think you did share this, it's going out in a survey, or how is that being asked of parents?
We will send a communication that the board approved the plan and that it includes the pool testing on the 18th. And it will have a link to the forms. And then we will do all of the other outreach that we will do, including sessions
The
to
webinar.
answer people's questions and outreach directly from our multilingual staff and things along those lines to make sure that we can get the number of people that are joining the pool. And I think the other thing that, that we know from other places that have done this is that it starts low, and then when people see the value of it, then people join. That there's a lot of people that no matter how many times you send it out and all of that won't know about it, but then when the first time that they have to quarantine and they say, is there anything that we can do? Yeah, you can join the pool. Oh, wait, if I had joined the pool, I wouldn't have to quarantine. Where do I sign up?
So that was going to be my question, is would we expect to have the number, but it sounds like part of it is the expectation the number will increase once families understand the benefit in real time, that it's going to keep them from having to be part of quarantine?
Yeah.
Okay, thank you.
I don't see any other questions from the board. I want to thank Nurse Tina and Dr. Gita for being here tonight.
Thank you.
Okay, now we're moving on to new business. First, we have consideration and action to approve board policy BED, public participation in remote meetings. Is there a motion?
Second. You moved.
Mr. Rodriguez, seconded by Mr. Youssef. Mr. Superintendent, when you are ready, will you please speak to this motion?
Thank you, Madam Chair. As a result of the COVID-19 pandemic, Governor Mills declared a civil emergency in March of 2020. Under the emergency powers associated with that declaration, school districts were given the ability to hold their meetings via remote methods, including telephonic or video technology. The uses of this technology proved to be a valuable means to increase public engagement and participation in board business. During the 2021 session, the Maine legislature passed LD 32, an act regarding public participation in public meetings. Under the provisions of this legislation, public bodies must pass a policy authorizing remote participation by public officials and the public in order to be able to continue to hold remote meetings. Tonight, you're being asked to approve policy to this effect. The proposed policy BED will allow board members to participate remotely under specific circumstances, including declared emergencies and special circumstances that impede in-person participation. Consistent with LD 32, whenever a meeting is being held remotely, the public will be given the opportunity to also participate remotely in addition to in person. The policy as proposed outlines the circumstances under which a board member can participate remotely and the procedure for announcing remote participation by a board member. It also outlines the board's notice requirements to the public regarding their ability to participate remotely. Finally, it assures that remote participation by board members is considered full participation for attendance and voting purposes. The proposed policy is based on the model policy developed by the Maine School Boards Association. Our proposed modifications have been reviewed and approved by legal counsel. And in order to accelerate the approval of this policy and allow for subsequent meetings, including the meeting on August 17th to be held remotely, this policy is being read and approved in the same meeting. As some of you know, our plans are to have the technology installed tomorrow that will allow our August 17th meeting to accommodate remote participation by board members who meet the criteria in the policy, as well as the public. Going forward, our intent is for the remote option for the public to remain indefinitely in order to make it simpler for the public to participate in the board's work. And so that's what you're being asked to do tonight.
Thank you so much, Mr. Superintendent. Are there questions on the motion on this new policy? Mr. Burke and then Ms. Russell-Better.
First off, Superintendent, could you restate something you said towards the end about the indefinitely? What are you planning for indefinitely?
So indefinitely, what we're, part of what we're hoping to achieve with this policy is that we will always have, going forward, even if everybody on the board were here in person, that we would still have remote participation available to the public. So that's the piece that we would envision doing indefinitely.
Okay, as an option, it would remain indefinitely. Understood. And for public participation, it would be hybrid in this. The people could come in person.
Correct.
Or be remote.
And the law requires that if we are in person, that we also offer in-person sessions. So anybody who wants to be here today would always be able to be here. Even, if the 3 absent board members today were participating remotely for, whatever reason, the fact that we were here in person would mean that the public could also attend in person.
Okay. Thank you.
Thank you, Mr. Burke. Ms. Russell-Better.
Thank you, Chair. Superintendent, could you just help me picture logistically how, so if we were having, the next meeting, the remote, both board members and public, like how would we be seeing it? Or, and I'm also curious for the public, is it just hearing them or will we see, like what would that look like?
Well, we won't, for the public, it will be the same. Well, let me just start with what you will see. The screen behind us would show the everybody here, plus anybody who was, on a Zoom call. Okay. They would be visible. There would be another television somewhere over here that we would, so you would not have to necessarily be looking over your shoulder. You would also be able to see it here.
So then the public could also see the remote members in attendance.
Correct. People who are remote, who are not here.
Yep.
So the public that's here would see that on the screen.
Yep.
the public that's remote would see it on their screens, whatever it is, their television sets or their computer screens. They would see all of us. They would hear all of us. They would also hear all of the board members who were remote, in the same way that they hear them when they're on a Zoom call. And they would also, when we had public participation from the podium here, everybody would see it on the screen via the cameras. When, we had public participation from people in the audience, we would not see them, we would hear them. We would have a box on the screen that would say, Mary Smith, and, in the same way that we do during a Zoom meeting. So they would be basically accessing it through Zoom. That's my understanding of it. We are having it installed, tomorrow and Thursday, and then we will test it next week before ahead of the board meeting.
Thank you.
And I don't know, anything else, Gavin, that I left out?
No.
And I think you've all met him via Zoom, but here's the real Gavin Goodall.
In the flesh, nice to meet you guys in person. No, that's right. We would access them via Zoom, and of course, they could choose to have their camera on or not.
And then, if there was a presentation, I understand it would be the same.
Yes.
They would see it. Henry in the control room will flip a switch, and it will be like in Zoom. So the main thing that people will see is the presentation, and then on the side they will see the room and the other board members, and in the same way that you see it currently.
Thank you, Ms. Russell-Better. Ms. Bundo.
Yes, thank you. So this is just concern for the business meeting. What about the committees? Are we going to still meeting with the different commission? The committees is going to be still on remote, or what policy are we going to apply?
I think we're going to try to do those remote.
Okay.
The only place where we will have the capacity to do what I just described is here. So otherwise, we need to decide whether we want to prioritize, public participation, and it's easier for us to do that if we're doing the meetings remotely. So we can just hold our committee meetings via Zoom.
Okay.
And then, those are recorded, and, Henry rebroadcasts them. People who want to join have the ability to join. For the most part, we don't have public participation in committees, but, that doesn't mean that people don't watch them afterwards or.
Exactly.
along those lines.
All right. Thank you. Thank you.
Thank you, Ms. Bondo. Mr. Burke.
No, I was just.
Oh, you're just acknowledging me? Thanks. I have two questions. What's the technology that we're installing? Is it a meeting owl? Is it something else? Not a meeting owl?
It is not a meeting, it's something far more robust. It's Henry can speak better to the actual technology, but there are cameras more that would look like this that have a much wider scope, and audio technology, so we can get audio input to the soundboard and send it to the Zoom call. So the main thing is capturing the video, sharing the screen, and then most of it, Henry, my understanding, is the audio ability to have folks, for you to be able to hear people on Zoom and people on Zoom to be able to hear you.
Okay, great, thanks. And my other question, what are some examples of members meeting the criteria to participate remotely? I mean, I read the copy, of course, but I'm just curious if you'd like to speak any further to that of.
I mean, obviously, a declared emergency is one, right? And then the other is illness or other physical condition or temporary absence from the area governed by a board that causes a board member to face significant difficulties traveling to and attending in person at the designated physical location of the board meeting. So basically, it would be, I can't be at the board meeting because I'm sick or something along those lines, but I can totally join via Zoom, and that would be considered attendance at the meeting.
Okay, thanks.
And then it does, go on to say that prior notice of the board, absence to the chair and so on, which is our current practice. So it would just mean that in this particular case, you wouldn't actually have to be here. You would still be able to be a voting member of the board.
Thank you.
I have just one question, which is whether we would want to include something that affirmatively states that the members of the public that participate remotely have equal access to comment during the board discussion, so that, for instance, or if we want to specify any procedure, I know we could go into this in depth, but I was just sitting here thinking, maybe it would make sense to have one person, if there are people wanting to comment both who are physically here and who are participating via Zoom, maybe we'd want one here and then one on Zoom, and to alternate or something of that sense. Do we want to, and I know that this policy acknowledges that we might want to set additional another policy governing public participation remotely, to get into the procedures. But I'm just wondering if in this policy we want to affirmatively state something about that the public's ability to participate won't be affected by whether they're in person or remote. Because I think that weighs heavily on some people when they want to come and speak with us about an issue. They're trying to figure out, well, does it make sense for me to get here physically, even if that's a difficult thing to do versus getting on the phone. And from my perspective, I want people to be able to participate I want to have the fewest barriers to participation. So I would want people to know that participating via Zoom is just as valuable as coming and being in person. So I guess that's a question during board discussion, but anyway, I'll put that out there now. Mr. Rodriguez.
Thank you, Chair. I just wanted to, as you were talking about possible options for process to take public comment, I wanted to suggest that we keep that as something that the chair's judgment is used. But I do agree with what you're saying, that, we, in general, the board, not in general, but always the board values, public input, and our policy, BEDH, states so. So we always have that to affirm what the board's position is in regards to public comment. But again, in terms of the process, should you have, 100 people on Zoom and 3 people here, I think your judgment, I think it's what I would suggest that we rely on as chair. You are in control of how these meetings are ran, and even as you did today, you are in control of how you run the public comment section as well. So I would just say that.
Thank you, Mr. Rodriguez. I appreciate your wisdom. Ms. Russell-Better.
Thank you, Chair. I just had a couple questions. One of which is in agreement with the chairs, just maybe us being explicit in policy about the in-person and remote participation being on equal footing. But I also am wondering whether having an option for someone to be on the screen, should be, and I'm wondering if someone wants to be, that just makes it feel to me, if someone doesn't want to be on screen, that's fine, and just hearing the voice, that's not an option. If it's not, not an option technically, then.
Right, I think that we moved to using the webinar format to prevent, Zoom bombing, right?
Okay.
And so,
Okay.
People have to be allowed in, and my understanding is when they're allowed in, there isn't the ability for us to see them. So,
But could they, once they were allowed in, could they temporarily be put on to panelist and then put back? I'm just wondering not that I feel that it has to be face-to-face, but it does add a quality that if we're talking about someone in person and someone that is remotely coming in, I wonder if that's a valuable option to have. So I guess I'm just putting that out there as, is that important for us to have?
I
as
don't
an
know enough about the capabilities. I don't manage the Zoom interaction, so I don't know.
I mean,
and I don't know, Aaron or Gavin, do you know if that is a possibility? And then I think it's a question of whether you want to do it or not, but I don't even know if it's a possible.
Yeah, just as at times, if somebody doesn't have their panelist link, you can promote somebody from attendee to panelist. So typically, we use the, allowed to talk is the feature that we have been using for public comment, and that's where the video is not. So it isn't full panelist kind of participations, because panelist as well is some of the chat and other features. So it would just be a decision point, like the superintendent's saying.
But you could promote them to panelists, and then if you promote them to panelists, then you actually see them.
Yes.
They would have the option to turn video on, as any panelist does, and then you can, send them back to attendee status.
So I think part of why I'm thinking about that is I'm remembering when we had a meeting with great participation from multilingual folks, and for whatever reason, I'm remembering those folks being on camera. And I'm wondering whether both in person and remotely, are we going to be discussing having translation also as part of public participation? And so I'm trying to imagine the remote folks having opportunity to have translation as well.
As the person who does the back and forth with Zoom, I have to say that it does add some, I think, dangers and complications. And I do think is not necessary, for some, like being on video is a barrier.
Yes.
So, but in general, I think today, we have a real urgency to approve this so that at our next meeting, when we're actually voting on our reopening plan, we can have greater public offer greater public participation by having a remote option. So I say, let's move forward with this policy, talk about any additions that, anything else with the policy, but then if we need to go back and look at the procedure for remote participation, we can do that separately.
Okay. Well, I'm less concerned about I hear what you're saying about risks, and also I don't think having video is most critical, but I really feel like our plan about having translation both for remote and in person, and I don't know if that's part of this policy or not.
I think that's definitely not part of this policy.
Okay.
But this policy does speak to, and it's not the only place that our policy does, that individuals with disabilities seeking a reasonable accommodation should contact us in advance of the board meeting.
Yep.
So that extends to translations when we know that somebody is going to need translations, but we don't have the capacity to translate every language at every meeting.
Yes.
Without prior notice.
So, but would that, Superintendent, be part of this policy, getting more specific about what that means? This much time would have to be...
That would be part of the procedures that we could, we can develop more specific procedures if the policy committee wants us to do that.
Okay.
But, for today, it does say individuals with disabilities seeking a reasonable accommodation should contact us ahead so that we can provide those accommodations. And so anything, that we can do for individuals with disabilities, we can do for individuals who speak another language that we are able to support as long as we know about it in advance. But
okay. I guess I would feel like we would need to know exactly what those details are to then tell the public how that would be. So if you're saying, Superintendent, that we pass this and then that would be details perhaps, did you say through policy?
Through procedure.
The committee work, it would be.
But we're already doing that. If we know that there are families that want to participate that need translation, we provide that.
But I don't think, Chair, that that's a process right now. I don't believe that someone, and I don't believe that the community is aware that that is a policy that we have, that they would need to let someone know. I mean, that's there, but I don't know that that's a well-known expectation that they would let the school department know about the language need. That's all I'm.
I think we've been let know, when people wanted to come to the board meeting and speak, and we will continue to do that. And, the same extends to, the sign language interpretation and things along those lines. So I think, to the extent that somebody lets us know,
Okay.
this is common practice. This is not just like the Portland Board of Education. Public bodies all over the country do this, and this is the way that it's normally done, is people contact the organization in advance and say, because you may not have somebody there that is going to be able to, speak Acholi, I would like to, have somebody there because I'm going to come and I need, interpretation. So we can do that, and that, I don't know, what else we can do to make it known to people, but, the procedure itself is not going to be any
Okay.
different. It's just, so do we need to do more to advertise it? Maybe.
Okay, well, I guess I was just thinking, in this process of looking at a policy, and this is, a place where the public might follow, it just seemed to me an opportunity to maybe emphasize or give more detail to that piece. So that's, I guess, what I'm.
I think that's why it's in the policy now,
Suggesting.
that it just
Okay.
speaks to that, so. But.
Mr. Rodriguez, is this a question? Because I just want to emphasize we're still at questions.
It's just an opportunity to clarify really quickly. It'll take one sentence. To Ms. Rosalbetter's questions, I would think that those questions and that theme is probably more appropriate for our actual public participation policy. So we can probably pick that up in the policy committee, and that's BEDH. And I think that might be a more appropriate place. But to your point, it is something that the board can discuss.
Okay, thank you. If there aren't further questions from the board, I'm going to move to public comment. Don't believe there are members of the public still present, so I'm going to close public comment and move to board discussion. And I don't see anyone jumping in, so maybe I will and suggest a couple of small changes that I think to clarify what we're saying here. So if folks can move to the second page of the document. The second paragraph starts, the opportunity for public comment at board meetings applies to remote public meetings. I understand that, but I think it would be clear if it said applies to remote participation in public meetings. Wondering if there are any thoughts on that. Maybe I have a couple other suggestions that are just for clarifying what the language is saying. So in the next paragraph, in the third paragraph, it says members of the public participating in public meetings of the board are expected, blah, blah, blah. I think what this is saying is members of the public participating remotely in meetings of the board.
No, I think that's for everyone.
But this is a policy about remote participation. Okay, and then the third suggestion is at the end of that sentence, we say, or in such rules as the board may develop specifically for remote meetings. And again, I would like to say remote participation in meetings. So the confusion for me is some of this language is about remote meetings, whereas it's actually really, the policy is about remote participation. The meetings aren't remote. We're just enabling, in limited circumstances, board members and generally the public at large to participate remotely. So I don't feel, I'm not going to follow my sword on these. I don't feel very strongly, but those are three suggestions to just clarify the policy in my mind. So I guess looking to the other board members, is anyone else interested in those changes? Again, I don't want to prolong this consideration of this policy because it's urgent that we move forward with it tonight, but I do think that that would help clarify the language a little bit. Mr. Burke.
Could you drop that in chat, please?
Oh, geez, chat.
We don't have a chat.
We don't have a chat. I'm like, where? I'm starting to type. Where am I typing?
The 3 instances, I just need to review them with you. So, second paragraph, second line, remote
Go up there and put it on.
participation in public meetings is change 1. I've lost change 2 that you're suggesting.
Change 2 is the second paragraph, the third paragraph, members of the public participating in public meetings. I would say members of the public participating remotely in meetings.
Okay. And then 3?
And then 3 is at the end of that sentence. It says that people have to comply with the guidelines for public participation or in such rules as the board may develop specifically for remote, and right now it says for remote meetings, and I would add for remote participation in meetings.
Got it. Thank you.
Yes, Mr. Rodriguez.
Thank you, Chair. I think on that second first of all, let's take them in order, actually. On the first suggestion, the opportunity for the public to comment on board meetings applies to remote public meetings. You wanted, I didn't understand the thought process behind changing that.
To remote participation in public meetings. Okay, I don't want to,
Okay.
I just worry this is confusing things and this policy is fine.
Yeah.
So I guess, maybe I'll just move past those few clarifications. Yes, Mr. Burke.
I'd say, I think it's fine language change to the question at hand. The point, as I understand it, is that these are public meetings, we're in person, so it's about how people are participating in it, and that is
Yep.
they're remotely participating. That only in very, in emergency circumstances would the full meeting go remote, so that's a more specific, less frequent circumstance for which we're trying to solve for right now.
Yep. Okay, is there any other board discussion? Okay, by roll call vote, please indicate whether,
We changing it?
no, whether you are in favor of approving the policy BED, remote participation in school board meetings. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Sorry. Ms. Bondo?
Yes.
Mr. Burke?
Yes.
Mr. Rodriguez?
Yes.
Ms. Russell Better?
Yes.
Mr. Youssef? Yes. Ms. Chung?
Yes.
And Chair Figdor?
Yes. So the policy is unanimously approved, and we're moving on to the next item, which is first read of the administration's school year 2021-2022 school reopening plans for a full return to in-person instruction while adhering to public health requirements. And as the superintendent spoke to earlier during the board focus, we'll begin our next meeting on the 17th with a public hearing on the school reopening plan. There'll also be an opportunity for the public to comment during our consideration of it later in the meeting. And of course, another opportunity for the board to ask additional follow-up questions. Next, we are moving to personnel items. Consideration and action to approve the personnel items listed. Election of teacher candidates, 1 year only. Ms. Stoddard, do you want to speak to this motion? Sorry, is there a motion? Mr. Burke, seconded by Ms. Bondo. Now, Ms. Stoddard, would you like to speak to this motion?
And while Barb comes up, I do want to recognize that we normally, in June, ask for board authorization to be able to hire during the month of July, and it was an oversight on our part. We did not include that. So you are, in effect, ratifying offers that have already been made. So that's, that's not the proper form, and I apologize for that, but just want to be clear that, these folks have been offered positions and have accepted them, and so that's what we're bringing you today.
Thank you for that clarification. Ms. Stoddard?
Yes, good evening. So you're going to be asked to approve 3 separate slates. This first one is for 7 one-year-only candidates.
Excellent. Are there any questions on the motion?
I just need a clarification.
Yes, Ms.
Just
Panda.
need a clarification for those 1 year. So those can be renewed year after year, or just 1 year, and then we can hire other employees. So we just have them for 1 year. All the time I try to understand why we have those 1 year only. And then what's going to happen next? We don't need them, or we going to hire other staff?
So one-year-only positions are for 1 year only, and it could be for a variety of reasons. It could be just because we're hiring some extra people for this year, or it could be replacing somebody who's on a leave,
Okay.
who's returning to that role.
Oh, that were, okay. All right, perfect. Thank you. Thank you, Chair.
Thank you, Ms. Pondo. Any other questions? Okay, there's no public comment on personnel items, so we'll move to board discussion. Seeing none, by roll call vote, please indicate whether you are in favor of action to approve the personnel items listed. Election of teacher candidates, 1 year only. Mr. Superintendent, will you please call the roll?
Yes, Ms. Bondo,
Yes.
Mr. Burke,
Yes.
Mr. Rodriguez,
Yes.
Ms. Russell Better,
Yes.
Mr. Youssef,
Yes.
Ms. Chung,
Yes.
and Chair Figdor.
Yes, the motion is unanimously approved. Next, we have consideration and action to approve the personnel items listed, election of teacher candidates, probationary. Is there a motion?
Moved.
Mr. Youssef, seconded by Mr. Burke. Ms. Stoddard, do you want to speak to this motion?
This is a list of regular permanent hires of 47 educators.
Excellent, thank you. Are there questions on this motion? Mr. Burke?
There's one person that appears on both the lists that we just approved and this list as well. Looks like half-time on each list. Could you just help me understand how that works, I guess?
Yes.
Yeah.
So that individual is being hired permanently half-time. The other half of that position is grant-funded on a 1 year only basis.
Thank you.
Thank you, Mr. Burke. All right. I don't see any more board questions. There's no public comment on personnel items. Is there any board discussion? Seeing none, by roll call vote, please indicate whether you are in favor of approving the personnel items listed, election of teacher candidates, probationary. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo,
Yes.
Mr. Burke,
Yes.
Mr. Rodriguez,
Yes.
Ms. Russell Better,
Yes.
Mr. Youssef,
Yes.
Ms. Chung,
Yes.
and Chair Figdor.
Yes, the motion is unanimously approved. Next is consideration and action to approve the personnel items listed, election of first continuing contract teachers. Is there a motion? Ms. Russell Better, seconded by Mr. Burke. Ms. Stoddard, will you please speak to this motion?
Yes. This is the election of one individual who has served in 3 1 year only positions and is now being hired into a permanent position.
Thank you, Ms. Stoddard. Are there questions on this motion? Okay, seeing none, there's no public comment on personnel items. Is there any board discussion? Seeing none, by roll call vote, please indicate whether you approve of the personnel items listed, election of first continuing contract teacher. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo,
Yes.
Mr. Burke,
Yes.
Mr. Rodriguez,
Yes.
Ms. Russell-Better,
Yes.
Mr. Youssef,
Yes.
Ms. Chung,
Yes.
and Chair Fagdor.
Yes. And the motion is unanimously approved. All right, we are ready to adjourn our business meeting. I want to underscore that our next meeting on the 17th, we will have the ability, as per the policy we just approved, for the public to participate remotely and in person. And there will be information that goes out that is clear about how to participate remotely. The in-person meeting will be here again at Casco Bay High School. And with that, is there a motion to adjourn? Ms. Bondo, seconded by Mr. Burke. All in favor, just with a show of hands. And we are adjourned at 8:46 p.m. Thank you so much, everyone.